Hello, I'm Dr. Michelle Jorgensen at Total Care Dental and Wellness, and I want to teach you how to take care of your mouth. Now, you might think, well, my mom taught me this. I know how to do it, but there are some simple things that people don't know that really make a huge difference in how healthy your mouth stays. And when I'm talking about taking care of your mouth, I'm not just talking about your teeth. I'm actually talking about your gums, I'm talking about your tongue, I'm talking about this whole thing here. So let's walk through this. It's not complicated. There are just some little important pieces that you may need to add. The first is, let's talk about what your mouth condition may be like even when you go to brush your teeth. When you have a lot of acid in your mouth, the teeth are soft, and that's actually the worst time to brush your teeth. I tell people this: if you've thrown up, if you're pregnant and throw up, the worst time to brush your teeth is right after that's happened, because the teeth are going to be softer at that point. The same thing happens if you've eaten a lot of acidic foods. So you don't want to brush your teeth at that point. Sometimes even in the morning, we're a little acidic because we've been detoxing at night. So what I recommend is actually starting with a mouth rinse. Now that might sound a little weird, but just a little to try to alkalize your mouth and balance things a bit. So just rinse some around, swish some around if you feel like your body is very acidic. Now, how often do I do this first? Not very frequently. Only if I really feel like, yeah, things are off for me. I usually don't start with the rinse, but that is something, if you feel like you are acidic, you should start with. Let's start talking about how to brush the teeth. Now, of course, everybody knows how to do this, but I want to show you a few little tips and tricks. First of all, what toothbrush should you use? Always soft. Make sure you're using something with a soft bristle on it. I joke that the only thing you should use a hard toothbrush for is to clean the toilets and the oil on your driveway. Why? Because those bristles can be very abrasive to your teeth themselves, and we don't want that to happen. So a soft bristled toothbrush used the correct way is all you need. What's the correct way? So when you hold the toothbrush, you're going to put the bristles obviously towards the tooth, but you're going to angle it slightly toward the gum. So you can see here on my front teeth, I'm angling it slightly upward. You rotate it back and forth like this, just slowly back and forth, and then you sweep it down. So you can see what that looks like. Now I'm going to move to the next section and do this all the way around. Typically I spend about a minute doing the front surfaces. I'll spend another minute doing the back surfaces, then another minute on the bottom, and go around. You don't have to use a mechanical toothbrush. In fact, if you use a rotary toothbrush, some version of an electric toothbrush, it will do a lot of that work for you. When you put this on the tooth, it's doing a lot of that work for you. The idea is to get the plaque away from the gum and down to where you can spit it out. I like burst toothbrushes, but I also like Sonicare. I also like Oral-B. Why would I choose one over the other? Honestly, it's personal preference. They all have advantages and disadvantages. The Sonicare has quite a large head. The Oral-B has a smaller head. So if you have a small mouth, choose the Oral-B. Some people love the Sonicare because it feels like a traditional toothbrush. I like the burst because it actually has a different vibration. It feels a little softer in my mouth to me, so it's the one I prefer. Whichever one you prefer, that's what I want you to use. What do you brush with? This is really important. If you look at a traditional tube of toothpaste, I want you to look at the ingredients. First of all, I want you to see if you can pronounce all of those ingredients. You're not going to be able to, because there are things like surfactants and disinfectants and preservatives and sweeteners and coloring and all those kinds of things that don't do a thing for you or for your mouth or for your teeth. They are there simply to preserve that product, to make it foam up, to make it colorful or taste sweeter. None of those things are a benefit to your mouth or your teeth. Why would you add them in? The good news is you don't have to anymore. The other thing that is on that toothpaste tube is a warning about fluoride. It tells you right on there that if you consume too much, it's a toxic hazard for you and particularly for children. So why would we use it? You don't have to. I've created a product that has something called hydroxyapatite in it. What is hydroxyapatite? It's this. It's the mineral on the outside of the teeth. This has hydroxyapatite in it. So if your tooth is weakening, if acid and just other things that happen in life are pulling the minerals from your tooth, you get to put them back in. There is a remineralizing product that's a mint flavor. There's also the exact same product in citrus. Some kids don't like the mint. So these are great products to help keep your teeth strong, to help prevent cavities, and they even help remineralize when you have the start of a cavity. There are a couple other options that you can choose from as well. There is a whitening version. It has the same remineralizing hydroxyapatite in it, but it also has some other agents that help to clean and oxidize the teeth and make them a little whiter. This is a sensitive version. This has something called arginine bicarbonate in it, which has been shown through research to be very good at helping with sensitive teeth. All of these have the same hydroxyapatite, the same remineralizing potential. That's going to be brushing. So how long should that take you? 2 minutes or so? If you spend a half a minute on the front of the top, half a minute on the front on the bottom, and then switch to the insides, about 2 minutes. So you're into this maybe 2.5 minutes, if that. Now what comes next? Most people say you need to floss your teeth. Well, I'm going to tell you that you don't have to floss your teeth. Yep, I said it. You don't have to floss your teeth. But I do want you to get in between those teeth with something. What are your options? You can use floss. There's all sorts of different versions. I like some that have less of the products that the toothpastes have as well, some of the colorings and the flavorings and things. So there's some very clean versions of floss you can use. My husband loves to use it on a floss holder because he said it's really hard for him to get back into some of those areas. This makes it possible for him. You can also use something called a go-between or a proxy brush. This is a little product that just goes in between the areas. Be careful with this one, however, because this can actually push the gums down. I don't ever use these or recommend this unless it's a place that chronically gets food caught, a place that you've had some old dental work done, where things get stuck in there. That's what this is great for. Another thing that you can use is a water pick. So this is a handheld water pick. It's really nice because it's really small. There's enough water in here to do pretty much your whole mouth. This is nice to use to kind of just clean everything out. In fact, I like to do this even before brushing sometimes. One of my favorites though is something called a shower flosser. It goes in the shower so that you can do a water picking action while you're in your shower. It doesn't take any more time, it doesn't make any more mess, and you get a little extra bit of shower time in, which nobody complains about. Now, what do? I'm gonna let you in on a secret that not everybody knows. I actually don't do hardly any of these ever. I floss on occasion, but not every day. Why? Because my gums are healthy. Because I am using products that help my gums stay healthy. What are those products? One of the big things is mouth rinse. I showed you the mint one already. There's also a citrus one for kids. This replaces that bubblegum pink stuff that has fluoride in it that's really not good for the kids or their guts or their health. This is a citrus version. These are going to do a few things. First of all, they have hydroxyapatite as well. I figure if you're going to put something in your mouth, it might as well be building your teeth. But they also have colloidal silver. What is colloidal silver? It is actually a broad spectrum antimicrobial. What that means is it's going to help to balance the bugs. And the cool thing about this silver that we use is that it's selective. It doesn't pick the good bugs. They're bigger, they're stronger, they're hardier, and it can't kill them. It picks the little ones, which are the bad dudes. So it's going to take care of the bad bacteria, the bad viruses, the bad fungus that's in your mouth, and it's going to keep everything balanced. If you are brushing the right way, keeping cavities off of your teeth, keeping plaque off of your teeth, the gums stay healthy as well. And you actually don't need to do a lot of cleaning in between the teeth, just on occasion when something's in there. The mouth keeps itself quite clean if you keep it clean too. So that's the first thing, is adding the rinse. That's going to be after brushing the teeth. Now, I recommend when using the hydroxyapatite tooth products that you don't rinse after. This also has hydroxyapatite, so you can rinse with this after, because it's going to be just delivering more hydroxyapatite to the mouth. The last thing I do is tongue scraping. There's a couple of different tongue scrapers, and I'll tell you why I recommend tongue scraping. The tongue is like a shag carpet. It's covered in all sorts of, they're called papilla, and it has all these places that things can get caught. So a tongue scraper is a very important part of a healthy mouth routine. How do you use it? This is a metal one. You put it all the way back to the back of the tongue and then scrape forward. You're gonna see gunk on it. You're gonna rinse that off. You're gonna do it again until no more gunk comes. There's also a very simple one that looks like this. You just bend it that way and do it forward. Lots of different versions. Now, all of these things sound like a lot, but let's take it down to the very simple matter of the steps and how to do them and when. If you're very acidic, you're gonna do a pre-rinse. I don't do this very often. You're gonna brush 2 minutes, make sure you're covering every surface and you're moving the plaque from the gum down into the mouth to spit it out. You're gonna use a hydroxyapatite product. You're gonna clean in between the teeth if you have places, dental work, that needs it. If you have gum disease that you're working to treat, you're going to need to do this right now. But you may not need to do this every day if your gums and your teeth are healthy. You're gonna follow up with a rinse, 30 seconds. I find that sometimes if my tongue's a little sore, sometimes I'll get what's something called geographic tongue. I'll actually leave it in there a little longer. So 30 seconds or so, tongue scraping, 10 seconds. When you add all of this together, maybe 3 minutes, maybe 4 minutes total. Do you do this twice a day? You brush twice a day. The rest, you can do once a day if you'd like. Very simple, very effective. A few steps to a healthy mouth.